Hey baby nurses, it is me, Nurse Meg from nursemegRN.com. Welcome to the channel. If you are looking for resources as a new nurse or resources as a nursing student, you should definitely be following this channel. Go! This video is for brand new nurses. This is what a new nurse should know before they start their first shift. So, couple of things. Congratulations on passing school and passing the NCLEX and finding a job. Oh my goodness, that is a big deal. If you are still in the process of looking for a job, I want you to go look down below in the description and click on the link that says New Nurse Interview Tips and Tricks. It's gonna tell you what to wear, what to say, what your resume should look like. I used to hire brand new nurses for our floor. This is what I wish nurses would come in and say and do, and I would hire them instantly, okay? So it's all of the secrets from the other side of the table, okay guys? Now, to prepare for your first shift, obviously you need to have the right gear. You need to have a really good stethoscope, you need to have good shoes, comfortable scrubs because you're gonna be moving, bending, squatting, lifting. You don't want like those like really stiff ones, you want ones with stretch. These are really great. These are Benefit Medical. These are like my favorite ones. I also love Grey's Anatomy because they're very like, you know, flattering and they're also super stretchy. I actually have an entire article that talks about the best gear for nurses. I'll link that below too, totally free. Links to where you can buy some of the stuff on Amazon and get a good deal. Also some like coupon codes and stuff to make sure that you guys are being conscious with your money as you're a new nurse and starting this brand new career. I also want to talk about you need to get a good night's rest before your shift. I know you're going to be super nervous. Everybody is before their first shift on their own or when they're starting orientation. Go to sleep early, turn off your screens, put your phone super far away from you, don't watch TV, try to do a little bit of meditation and relax and get as much rest as possible so you can really hit the ground running on the next morning, on the next shift. Another tip is to get there early. You want to get there, you know, 15-20 minutes before your shift or before you have to clock in so you can get your assignment, see who you're working with, all of that stuff, look up your patient and sort of get a feel for the day before you even start. Another great tip is you're going to want to pack your food, pack a bunch of snacks. You may be super duper busy, but you don't want to waste time running to the cafeteria or sitting down and trying to eat a huge meal. When you get a chance, just eat, you know, a little granola bar here, a little apple here, like whatever snack that you can kind of grab every couple of hours just to kind of keep your momentum and keep your energy up. Definitely try to make time to eat and drink because you're just gonna think more clearly and it's really gonna help you keep the momentum throughout the whole shift. All right, I wanted to give you some tips on how to initiate report. I want you to know who you're getting report from early when you come on, when you clock in, when you do your little huddle or whatever anybody does in the hospital or your personal hospital, and find who you're getting report from. If they're running around, ask them if you can help them with something, like, hey Cindy, can I help you with something? Hey Sam, do you need help just like finishing stuff up? I'm getting your group. Let me help you just get caught up so we can, hand off and do report and you can go home. Always like offering help and being courteous to the next shift is so important in establishing the culture of the floor and also your relationship with the other nurses on night shift or day shift, whatever you're working. It's really important for the culture to establish a helping and loving environment, and if that doesn't already exist, you be the change on your floor. I've seen it happen. I've seen one person change the dynamics of an entire floor, good and bad. So be that light, be that positive force on your floor. Now, when you are coming off shift and you're ready to give report and the nurse is sipping her iced coffee, shaking the ice, scrolling through TikTok, not really paying attention, and you're like, gosh, I feel so intimidated. I don't know how to initiate report. Let me help you. Here's a great phrase that you can say to initiate report. Hi Sam, how are you? Very important to know their name. Hi Sam, how are you? Listen to them. when they're done or they have a little opening, say, you have my group today. I printed these report sheets out for you. Let's get started. Like in a very non-threatening, non-aggressive way, but it's also like, all right, Sam, let's move it along because I want to go home. You want to start your shift? Let's go. That script actually is from one of my printouts from my course, How to Give Report in Every Scenario at Work. That course has a bunch of printouts on how to talk to the doctor, scripts on how to initiate report, how to give the best report sheet. Like it's a lot, but it's also just like a little mini course that I created. I do want to give you some free resources first. So I do have a completely free report sheet. It's the most comprehensive and clear report sheet. If you fill it out and read it top to bottom, it will be perfect report. Even the old crusty nurses will be like, wow, she really knows her stuff. You'll like impress everybody. I'll put a link down to that below. And then I also have another great resource that I want to give you for free, and it is a flow sheet. If you don't know what a flow sheet is, it's kind of like a way to organize your shift per patient. So you can click on it and download it and see what I'm talking about, but it really organizes your shift from 7 to 7. And what I usually do for each patient, I have one sheet that has the report sheet, and on the back of it, I photocopy the flow sheet. So for each patient, I have this double-sided sheet, and the front is report and the back is the flow sheet 7 to 7. It's gonna have their patient sticker, their labs for their day, there's a spot for I&Os, there's a spot for new orders or updates, and then for each hour, you know, you can put whatever you need to do. Okay, they go to a CAT scan at 2, their procedure is scheduled for this time, I need to get this done, there's another PTT due at this time, and you can like go through. I like to take a big fat Sharpie and cross out the hours as they go through. So if it's 4 o'clock, everything's gonna be blacked out until 4 o'clock. So it kind of helps you stay on task. It also helps you like hang on, like there is an end to this shift if it's a really bad one. And it also helps you not forget anything. So if you're staying on task and not forgetting anything, you're gonna be the new grad that doesn't stay till 8 p.m. to catch up charting, because you have a flow sheet, you stay on task, and you get things done when you need to. So when 7 o'clock comes around, you're ready to give report and you're ready to get out of there. Now, before I go, I do want to mention, quick little mention, I have a full course for brand new nurses. It's called the New Nurse Survival Guide. Within that big video course, I have the mini course on how to give report and how to communicate as a nurse within the course, but I also teach you how to read EKGs really quickly, how to be confident in a code, how to run a code, the first 10 things that need to happen in a code, common labs and tests and why doctors order them, how to deal with coworkers that, you know, maybe are bullies, how to deal with really gross stuff, how to talk to family members is a really big one. So it's really the foundations of bedside nursing. It's kind of everything that I wish I learned in the first year, but learned over 12 years of nursing. That I wish I knew. So yeah, I just wanted to throw that out there. I do have that New Nurse Survival Guide. Of course, anything that I mentioned, I will put links down below to it. Or you could just go to my website, nursemegrn.com, and you can find me there. So thank you so much for watching this video. I will be thinking of you and praying for you on your first shift. Good luck. You survived nursing school and the NCLEX. You can do this. So many other people that are less intelligent and less qualified are doing this. You can do this, okay? I believe in you, and I will see you on the next video. Bye.